Okay, peptides, remember, they're short chain amino acids. They're very safe, they're very effective. They're naturally found in the body. We're now able to make them in pharmacies and use them for our health. We basically take them and we inject them into our system. When we inject them into our system, we use these small little insulin syringes. And you guys are going to notice yourselves that whenever you do the injections, they're really small. Often patients ask themselves, is that going to work? But shortly after you do the injection, you'll feel it in your system. Most of them have to be kept refrigerated. Not all of them, but most of them do. They can be very sensitive to light and temperature, so we're going to keep that in mind. What's one of the most powerful peptides we have? Well, the most powerful peptide, I would say the most popular peptide, is the one you've already heard of, semaglutide, right? Semaglutide is the famous Ozempic peptide. This peptide is basically what it does, it's going to slow down your gastrointestinal tract. So this semaglutide peptide, you're going to notice there's going to be a series of other ones that are very, very similar to them coming out. They're all going to have slightly different properties, but the idea is the same. It's to slow down your gastrointestinal tract. So what that does is going to make you feel full. The way people are losing weight with semaglutide, Ozempic, or other similar products is basically it's slowing down your gastrointestinal tract so you always feel full. So you're simply not consuming as much food. One of the good things about this, we've also noticed that guys are consuming less alcohol. If you're trying to cut back on alcohol, this is a possible way to do it and to lose weight. Now, are there side effects to the semaglutide? Yes, of course, there are indeed side effects. The side effects are if you take too much too quickly. If you take too much too quickly, it's almost going to halt your gastrointestinal tract, and you don't want that. Things need to be moving. Things are always supposed to be moving in your body. If you halt your gastrointestinal tract, you're going to have problems such as constipation. You're also going to have problems of vomiting, and of course, absorption of your food and nutrients as well as water. So it can be dangerous. With that being said, the nice thing about peptides is they're very short acting. They're in and out of your system relatively quickly. With the semaglutide injection, it's usually going to be in your system for about 7 days. And then you're going to need your next shot. So, with that being said, we do offer the semaglutide in the practice. It's been extremely successful with weight loss. And we have good news, we have the advanced products coming in as well. So you guys are going to want to keep in touch about that because we're going to send you updates when the advanced products come in. Let's talk about another side effect of the semaglutide. Another side effect of the semaglutide would be that you constantly have to increase your dose. Now, how quickly you have to increase your dose is going to depend on the patient, on the time, male, female, etc. But you will eventually reach a point to where it simply does not seem to be working and you've kind of maxed out on your dose. Well, that's when these more advanced products are going to be coming into play. So that's something to consider as well. This is not something you necessarily want to stay on the rest of your life. This is really good to be establishing changes in your dietary habits, breaking habits. So much of our weight loss challenges is one, marketing from the food industry to consume these horrible foods that are filled with processed and chemicals. Also the chemicals themselves that are in that food that actually stimulate your hunger processes in your body and make you feel hungrier. And again, the processed food also affects your insulin and your blood sugar levels, causing weight gain and obesity. So this product here is fantastic because it can help to break that habit. So semaglutide, awesome, by far the most popular peptide. It is available, and we have the advanced versions of this available in the practice as well. So keep this in mind if you guys want to lose weight this summer. Keep this in mind if you guys ever want to lose weight, and you're going to want to keep your weight loss at bay. Some guys are even using this for maintenance as well. So that's also available. Remember, when you're doing something like this, we still want to check your blood work. We still want to check your labs. We want to be checking in on you once a week. Be sure that you're doing well. And this is always going to work better when you're doing our other ancillary therapies, right? Such as our dietary guidelines and our testosterone therapy, thyroid, DHEA, our vitamins, et cetera, all the other tools we have for you. You put them all together, you reach your goals. Awesome. Let's keep in touch.